I have very good experience with the Denco microscope. So for me, microscope is not just a tool. It's like my friend, my companion. 𝐂𝐡𝐷 is a good choice to begin. Amazing files I've used.
Hi everyone, this is Monica from Denco, and this is the Dr. Hao Zhi in Malaysia. Could you please introduce your clinic briefly?
Hi. Thank you for your question, Monica.
Yes.
Yeah, so I'm a general practitioner and I have a special interest in endodontics. My clinic is in my hometown where I grew up. That makes me very dedicated to serve my local community and to make sure they receive the best standard of care and without to travel too far. I practice endo almost every day.
Before using the microscope, how do you do the RCT treatment?
Okay, thank you for the question. So before I purchased the microscope from Denco, I use loops with 5.5 times magnification. So for molar and retreatments and difficult canals, I usually will take CBCT. I'm using rubber dams. I'm using sodium hypochlorite. I'm using EDTA. I thought I'd done a pretty good job. However, when the case became challenging and difficult, example, when I have broken files, when I have ledges, when I have sclerotic canal, pap stones, I found it very difficult for me to manage the case. It took me a lot of time. And also sometimes I couldn't handle, I will need to refer.
And after you purchased the Denco microscope, and how Denco microscope helped you in your daily treatment?
Oh, okay. So for me, microscope is not just a tool. It's like my friend, my companion. All right. So when I can see my work clearly under the microscope, it guides me and it allows me to recognize my mistakes and my weakness. Okay, I'm starting to see the reason why my root canal treatment fails and why I can see better. I can see ledges. I can see the real canal beside the ledges. All right. So I can see the real path. I can remove metal posts and fiber posts more confidently. Also, I'm more confident to try for MB2, for sclerotic canals, to locate the canals, and to remove the pap stone without causing iatrogenic damage such as perforation to my work. Besides that, when we do the irrigation with the microscope, I can know, is it the canal is clean enough? When I flush, I see the debris come out, how much debris is coming out, and how clean the canal is. With the microscope, I'm less stressful in my work, I can do better, and of course, if we are less stressful, I have better quality of life.
And is there any moment you felt that you should have used our Denco microscope earlier?
Alright, before microscope and after microscope is very different. I hope I have used the microscope from the first day I practiced dentistry. I need to make something clear is that microscope is not only for endo. When I do filling, deep margin elevation, sometimes with the deep scaling, I use microscope. It really makes me look and able to see very clear. And whenever I see back my old filling, my old scaling from a previous patient without a microscope, I noticed I could have done better. So this is the moment I really felt I should have bought the microscope early.
If some general dentists ask about the microscope and also the file, what we will recommend?
Alright. Okay. So definitely I would recommend everyone to use microscope. But why Denco? Because I felt that the Denco microscope have some features that make me easier to operate with the microscope. I have very good experience with the Denco microscope. Also for the files, 𝐂𝐡𝐷 is a good choice to begin. And also because of the good quality, I have less risk of separate instruments. I have less risk of causing ledges. It gives less complication. I think it's a good choice to invest and to try out Denco 𝐂𝐡𝐷.
Okay. Okay, now, do you have any experience of using our chameleon dual shaper file?
Of course, that is one of the amazing files I've used. The very good thing about dual shaper chameleon series is that it is more resistant to breakage. It is more easy to go down to the canals, in curved canals, in sclerotic canals. I use dual shaper. It's very helpful in my clinical practice.